trauma is used so much now. So
Yeah.
people are confused, like, what is a clinical trauma? Like, what is a trauma I should go and seek help about? The thing about PTSD and trauma is that people feel such a high level of shame and embarrassment and fear that they don't get help. And I see people sometimes decades after the trauma occurred, which is really a shame because help is really available. But there's a lot of doubting oneself. Maybe I made this happen, or maybe it didn't really happen. Maybe it's not a trauma. Maybe, minimizing denial just to cope with what happened and not wanting to approach something that's so painful that happens to you. So a lot of people don't go into treatment. And sometimes maybe like a loved one will say, look, you're not really functioning the way you used to, or like you don't trust anyone anymore, or you just want to stay in the house all the time. Maybe it's time to talk to someone. So I think that there are so many negative feelings affiliated with trauma and the sense of self that, again, people often don't get the treatment that they need. And I think it's really a shame. I'm really glad that there are so many people talking about PTSD and talking about trauma, because it happens through the lifespan. It can happen early on. It really can happen to you anytime. And when you go through a trauma, it does change how you view yourself, and getting perspective about, what does it mean to me that I was in an accident, right? How do I feel safe back in the car now, right? Or if I'm in a relationship that's violent, am I ever going to trust anyone again, right? So medical, a lot of health issues. A lot of people end up in the hospital, have medical experiences. Um, you know, do they want to go to the doctor after that? Like if something terrible can happen, or is there health anxiety kicked up all the time? Like, oh, what's going to happen next? So when trauma happens, it feels like, the thing that you thought might happen, but didn't really think was going to happen, and actually does happen. And then you're like, well, now what? I don't have a sense of safety in the world. So that's the main thing that I can say about trauma. But there's so much treatment available now. There's so many empirically studied. There's research all over the world about trauma because so many traumas are occurring now.